Hello, everyone. Welcome to Ask Me Anything. If you are joining us today, we are having a conversation with Rebecca Vieh from Department of Public Safety on Track Kit. So if you've never attended an AMA, just so you know, we are here. We want to hear from you, our members, what questions you may have from the field. So this is your opportunity to post questions in the comments. If you're viewing from Facebook or from YouTube, just post it in the comments and we will be able to pop your question up later on. So we're going to go ahead and get started. Thank you for joining us today, Rebecca.
Good morning. Happy to be here.
All right. So what is the statewide sexual assault evidence tracking system, also known as TrackKit?
Hi, good morning. I'm happy to be here. Like I've already said, let's start with just the basics, right? So what is TrackIt? Very simply put, TrackIt is a software program that is internet-based, which makes it easily accessible to all users, 24 hours a day, 7 days a week, 365 days a year. And it allows all users to be able to document the location and the status of a sexual assault evidence collection kit. Most importantly, it allows the survivor to be able to see at any time the location and the status of their sexual assault kit. The way that it works is that all the sexual assault kits that are manufactured for the state of Texas get shipped to the medical facility already with a barcode on the kit and a survivor access card within the kit. So at the time of the medical collection of the forensic evidence, the nurse will input into TrackIt all the collection details related to that kit. And then when the survivor leaves after the exam, they are given a card with the URL for the TrackIt website, their TrackIt barcode, and a temporary password that will allow them to log into the system for the first time. And because we are tracking these kits all the way from the manufacturer through destruction, the survivor has full access to see at any time where that kit is located. Each user group has access as well. Their portal, we call them, looks a little bit different depending on the user group. But the user groups here in Texas are the kit distributors. Then it's the medical facilities, law enforcement agencies, the labs, and prosecuting attorneys also have access to see the data and track it.
Okay, that's a lot. So 5 different users and gives access to survivors to be able to track their kit. Awesome. So how long have survivors in Texas had the right to track their kit and why is it important?
So in Texas, we were very fortunate that in 2017, Representative Donna Howard out of Austin authored House Bill 281, which required DPS to develop and implement a statewide electronic tracking system to track the status and location of the kit through the various stages of the criminal justice process. That's really important that we have legislation in place to back the tracking process. Some other states have started tracking programs as well, but without the legislation, it makes it a little bit harder sometimes to compel the different user groups to participate. So we're very fortunate that we have that legislation in place. Most importantly to the bill author, it allows survivors to anonymously be able to track and receive updates on the status of their evidence. So TrackIt does not contain personally identifiable information about the survivor. The only thing that we see is that kit has a unique barcode and the survivor has that unique barcode. Also, everything that's entered into the tracking system is considered confidential and it's not subject to disclosure under the Public Information Act. And most importantly, I think for the success of the program here in Texas, like I said, that legislation was passed in 2017, but they gave us 2 years to fully implement it. So we had 2 years to learn from all the different user groups here in Texas what their workflow was for the sexual assault kit. We had time to make some changes to try to standardize that process. And most importantly, we were able to get input and feedback to make sure that the tracking system here in Texas matched what that workflow was. And then we were also able to train on the system to make sure that our nurses and law enforcement officers and our labs knew how to accurately enter information so that it would be as accurate as possible for what the survivor was seeing in their portal. I'm sorry, go ahead.
No, I was going to say, so I'm assuming that the training is still continuous as people join.
Yes.
Okay.
Yes, absolutely. So we did a really good job here in Texas of having our major urban areas on board on September 1st of 2019. But as you can imagine, they're very small rural areas of Texas that really didn't have a need to be using Track It in 2019 if they hadn't had a sexual assault in their jurisdiction in 5 or 10 years. So to your question and your point is, yes, absolutely. We are still adding some medical facilities and law enforcement agencies as that need arises.
Okay, thank you. And then as we hit 4 years of data on the tracking kits, what can we learn from what has been gathered?
I think the most important thing is just obvious things, right? We initially, when we would have the conversation around sexual assault in Texas, we were always asked how many kits are collected. And we really didn't know. To get a number around that, you would have had to poll every medical facility in Texas and ask them how many they had collected. You'd have to poll every lab in Texas and ask them how many they had received and worked. And so Track It really is a repository for all of that information so that it's readily available and we can quickly pull it. So the data as of this morning is we're tracking just over 37,000 kits.
Whoa.
Since, yes, ma'am. 34,000 of those are reported to law enforcement, meaning they're being investigated. And then about 2,700 of those are what we call non-report or anonymous kits, meaning that at the time of the medical collection, the survivor did not wish to involve law enforcement. And so that evidence is still collected and preserved and by the medical facility, and it's shipped to DPS. And we do not process it. We only store it until either the survivor decides to report it to law enforcement, at which time we pull that evidence and send it to the law enforcement agency for them to submit to their lab to be processed, or we store it until the statutory destruction date, which is currently 5 years.
So they have 5 years to decide whether or not to report, or else the evidence is voided. Is that what?
Yes, ma'am. That is correct. Correct. And so another thing that we can look at is the number of survivors who are using Track It. Once again, their right to be anonymous is extremely important to us. So we can't see exactly which survivor is logging in and tracking their kit, but we can see overall how many are. And so we know that right now we have approximately 24% of all survivors have logged in at least once, which may seem low, but when you look at tracking compared to other states, it's actually very, very high. And so DPS gives all of the credit to the usage of Track It to both the medical facilities and the nurses who are doing a great job of making sure that survivors understand they have this right. And also our advocates out in the field all over the state who, you know, I'm sure are getting those cards from survivors who are asking, what do I do with this? And so you all are doing a great job as well, just making sure that they know that it's available to them and they have the right to track the status and location of their kit. Also, we like to look at trend data now. We can see that over the last 3 years, people are receiving or seeking forensic medical exams at a much lower rate through the months of November, December, January, and February. So while we know that that's happening, we obviously don't know the why behind it. And so I think as we have more data, there will be more and more interest by researchers to maybe look at why that is happening. Another thing that we saw that wouldn't surprise anybody is a drastic decline in collections during the first few months of the COVID-19 pandemic. So as the state of Texas started to shut down, people were not seeking forensic medical exams at the same rate that they were prior to. And the most exciting thing, I think, is that we are still learning what we can learn from Track It. And we can use the data in the system to make more informed decisions on a statewide level. Another thing we've looked at is where are kits being collected as compared to where the population is, and where there are those gaps in services. So if we see on a map of Texas that there are no kits being collected in a very large geographical area, we know that survivors are having to drive a great distance to get the medical care that they need. And so we can use that data to help inform where do we need a SANE program, where do we need more medical resources for them. And finally, we have forensic nursing researchers that are really excited to look at the data. Just last week, I had one reach out to me that was wanting to know if we could correlate which medical facility sites have a higher track it user rate by the survivors, because what they want to do is find out if one medical program, most of their patients are using Track It, then what are they doing?
Yeah.
How are they presenting the information that maybe others can learn from? And so we're really excited about that, is just all the different possibilities and the ideas that people have moving forward. And we want to be able to use this data, like I said, to really improve the response to sexual assault for survivors in Texas.
And it's great that, one, not only do you already have data that you can work from, but that you're continuing to collect information in order to help better support survivors, especially since, you said the discrepancy is between what you're seeing in urban versus rural. It doesn't negate that there's survivors in both areas, but maybe that it's not as actively getting reported, and maybe this information can help them knowing that they can still get a kit tested and or submitted, even if they're not ready to report yet.
Yes, absolutely.
All right, y'all. So thank you, Rebecca. That was wonderful. We're not done yet. I have a mystery question here for Rebecca, but before I ask that, just a reminder, y'all, if you have any questions, post them in the comments. Yes. So while y'all take a moment to think of your questions. All right, I'm going to add a photo first. So my question to you, Rebecca, is, you can only have one forever, coffee or tea?
Oh, that is such an easy one. 100% tea.
Okay.
It needs to be super sweet tea, right? It can't be unsweet tea. I'm a 100% Texas girl, I guess, in that sense of I like my sweet tea. So
nice. I'm glad this was an easy one. I wasn't sure. I mean, some people have very strong feelings about coffee, and I drink coffee every day, but my answer is also tea, just because of the large variety of options of tea you can have.
Yes, I love to see that. So if I need I guess my bigger caffeine early morning fix instead of coffee would be soda, which is bad, but I'm either a soda or a sweet tea girl.
Nice. See, I didn't even put soda as an option, but now I know tea. All right. So we do have a question. Oh, someone else said tea. Thank you. All right. I'm going to go ahead and take those questions down and move us back to here. So someone said the website was telling them they had not created an account, but it would not allow them to put an email address in. Any idea of what might have been? What happened?
I'm not sure about they had not created an account. If they're using their I'm assuming we're talking about a survivor too.
Mm-hmm.
That's right. But yeah, if it's a survivor account and they're putting in their barcode and the password and it's saying something about like there's not an account there, what that tells me is that the medical facility hasn't entered the collection yet. So the survivor's account is not activated until the medical facility enters the collection details and hits save. So that could be what that issue is. But if you have more details about it or you want me to look further into it, please feel free at any time to shoot me an email or give me a call, and I'd be happy to assist with that. Oh, and that another great point about that is I should say the medical facility under current law has 2 business days from the date of collection to enter it and to track it. So while we really encourage the medical facility to enter it while the survivor is still there, because we explain the survivor can't access it until they enter it, we're asking the medical facility as well, if there is going to be some delay of 2 business days, to make sure they communicate that to the survivor so that the survivor knows, okay, I'm not going to be able to use this until Monday or whatever the case may be.
Thank you. And person, I'll just post it in here. They said thank you. So are there any more questions, y'all? If not, I'm going to move on to our last question. And if you have questions later on, you can still add them in the comments and I will be able to pass them on to Rebecca, as well as we will follow up in an email with Rebecca's contact information should you have questions there as well. All right. So final question, what does the future hold for Track It?
I think that's probably the most exciting part, right? Because as we get feedback from all the different user groups and survivors, it is my hope and my goal that it'll continually change and only become better as time passes. The important thing to say is that Track It will always fulfill its mandated requirement of providing accountability and survivor visibility. That's probably something I should have mentioned earlier. Those were the 2 things that were most important to Representative Howard, is the survivor visibility piece so that they could be their own advocate if needed, but then also the accountability piece. And that's kind of where DPS comes in, and our role of overseeing the program is, for the first time, somebody at the statewide level can see, where do we have kits that aren't moving? If they're stuck at a particular law enforcement agency, why is that? Why are they not submitting them to the lab? And we can help facilitate that movement into the lab where the kit should be. And then the same thing for the labs. There's a requirement that labs are having kits tested within 90 days from the date that they received them. And so if we see that labs aren't fulfilling that 90 days, just to be able to reach out and have a conversation. Is it a resource need? Is this a short-term issue? Is it going to be a long-term issue? To help, one, identify the issue, and then if it's a need that, maybe another lab can help address, so that survivors across Texas are receiving the same standard and level of service. And then as new legislation passes, we'll continue to update the system to ensure we meet those as well. Like, one great example of that is Senate Bill 1401 from this session is currently on the governor's desk waiting for his signature. And it has to do with the non-report program and the notification piece. So back in 2019, legislation changed that required DPS to notify a non-report survivor before we destroy that kit. And that was new. Mm-hmm. The issue with that was the language said DPS had to provide written notification, and DPS receives those kits anonymously. So we don't know who the survivor is. So we're really excited because we have been unable to comply with the law as currently written. And now, because of 1401, assuming that it is signed into law, what it says is DPS will make that notification through Track It. So we'll spend the next couple months making sure that we've got everything in place and Track It, so that on 9/1 of 2023, as those 5-year kits start to reach their destruction date, the survivor can opt in to receive either a text notification or an email notification 91 days from the destruction date. And that way they know they're right. If they want to ask us to keep it for longer, they can do that. But anyway, so there's exciting things like that were, 5 years ago, I didn't envision that we would be using Track It in this way, but we are, and it will continue to change. And also, if you have any feedback, I want to hear the good, of course, because that's always fun and exciting, but I also need to hear the bad. I need to hear the negative. So if you're working with survivors who are having struggles, or if there's something they like or they don't like about the system, please feel free to reach out to me and let me know that. That's the only way that we can get it changed and make it more effective and efficient for them.
Is it also open to survivors to provide feedback as well of what their experience was like?
Absolutely.
Wonderful.
Absolutely. We would, yes, I would love that. My interaction, obviously, in this role is very limited directly with survivors. But the couple times that they have engaged me, it's been extremely helpful to understanding how we can improve the system.
And at some point in the future, will there be a survey that people can fill out, or like anonymously submit feedback, or not anonymously? How do you
Yes.
how do you hope to receive feedback, I guess, is my
Well,
question.
well, that's a great question, because once again, this is not where my strengths lie. So I'm always looking for partners to both help me create that survey and then to distribute it. So yes, if you have any ideas related to that as well, I would love to hear it.
Okay. Well, y'all, that is all the time we have for this Ask Me Anything. I want to thank you all for joining us. I see you folks on the live stream. If you have questions, you can email me at ckawa@taasa.org, as well as you can email Rebecca. Do you want to say your email, or do you want me to just include it in the follow-up communication?
I will say it. It is Rebecca.Vieh as in Victor, IEH at DPS.Texas spelled out .gov, and then she will also share it with you.
There you go. Thanks to all for joining. Again, if you have any questions, go ahead and still ask them, and we will pass it along. Otherwise, catch you at the next Ask Me Anything, and thank you for joining us today.
Thank you.